While we're waiting for the questions, I'd like to ask our patient advocate on the panel, Judith Fitzgerald, to tell us a little bit more about the perspective from the patients on how these technologies and ctDNA monitoring can affect them, and what do they want from us to do next.
I want to thank all the researchers because I know that you sacrifice every day to make our lives better. Less toxic treatments and better quality of life are what we advocate for. And the more information we have, the better we can achieve less toxic treatments. And now we're getting to the point where in the metastatic setting, cancer is being treated as a chronic disease. What's exciting about the ctDNA and also biomarkers with the liquid biopsy is that it's non-invasive. By measuring ctDNA, we can maybe find out if the tumor has mutated and if the treatment that the patient is getting is appropriate. Precision oncology is kind of the new buzzword, where it used to be one size fits all, and that's not the case anymore. Clinical trials, particularly phase 1, where we're not just looking for the maximum tolerated dose, we're looking for the optimum dose, but we're also trying to find out why it didn't work. And we can do that by doing the liquid biopsy on patients that didn't respond. My first SABCS was in 2010 during what I call my deer in the headlights period. I was just out of treatment, and there was very little about immunotherapy. The big buzzword was Herceptin and HER2. And my sister-in-law was treated with Herceptin in one of the initial cohorts. If you want a good cry, you can watch Dr. Slayman's movie, Living Proof. Need a box of tissues, but it shows how difficult it is to get a drug through clinical trials, and also the sacrifice that the researcher has to do to get there. The exciting thing that we can actually go down to the molecular level of the tumor and see what makes that tumor, or find the Achilles heel of that tumor. It just, to me, is going to revolutionize the way we treat cancer. I'm so happy to be here and honored to be here, and I just want to thank all the researchers out there, because without you, I wouldn't be here. I know. I was in the group when the Oncotype test came out, and I actually had to fight with my insurance company, but it spared me chemotherapy. I didn't know anything about anything, so I asked my oncologist, I said, well, shouldn't I have it anyway? Isn't more better? And she said, no, because if your cancer comes back and we need it, we won't have it. I think that the more we learn and the more that advocates work with researchers, I always encourage people that I counsel to say, your doctor is not God. Give him some respect and just work as a partner. Because if you don't communicate effectively with your doctor, they're not going to know what's going on with you. These dedicated, all of you that are so dedicated, I'm just so grateful for. I just want to say thank you.